Yo, it's Doc P, Vagina Monologues. Let's talk about it. So, what I want to talk about today is advanced maternal age and infertility. I get friends, family, friends of friends, patients that come to me all the time and they want to know what can be done after 35 when you want to get pregnant. Or do I need to freeze my eggs when I'm 36, 37 years old because I'm considered advanced maternal age? And let's talk about advanced maternal age. How did that term come about and where did it come from? So advanced maternal age came up about because we looked at statistically what happened at different age groups when women got pregnant. So all the way from teenage years, 18, 19, 20, all the way to, 50, what happens during those times. And the reason advanced maternal age came about, or the age of advanced maternal age came about, because between age of 34 and 35, that is the first significant statistical difference in the rate of pregnancies and the success of pregnancies, right? So what they noticed is that at 35, there was a statistical decline in the ability to get pregnant as well as successful pregnancies, right? That doesn't mean that at the age of 35, you can't get pregnant. It just shows that at 35, you start to see a decline, right? But what people don't understand is that I've delivered patients as old as 44, 45, 46. I think the oldest patient that I delivered, it was either 47 or 48. No, actually, I think I delivered somebody that may have touched 50. Actually, 50 or 51. I'll take that back, because that was with in vitro fertilization. That's another topic. But what I say that to say that you can get pregnant. There's no need to automatically start freezing your eggs at the age of 35. I have patients all the time that come in and say, like, well, should I start freezing my eggs at 35, 36, 37? And my answer to that is no. And you can waste money. You can spend a lot of money freezing eggs if you want, but oftentimes it's not necessary. Let me tell you when it becomes necessary. When it becomes necessary is when you are getting closer to 40 and you don't have a partner, or you don't have a plan of getting pregnant, within the next 1 to 2 years. If there's a true concern about pregnancy and you don't have a partner, the very first thing that I would recommend is getting a lab called AMH, or anti-Müllerian hormone. And anti-Müllerian hormone basically just tests the quality of your eggs, right? So it lets us know that you have either high quality eggs left or not. And if you don't, and if that quality is low, then that's the time to start thinking about freezing your eggs or egg preservation. Another issue that I see all the time is that women will try to get pregnant and they're not getting pregnant, but they think that it's them all the time. 50% of the time, what we don't realize is that it is male factor infertility, meaning that men are the problem, right? Low sperm count, varicoceles. These are issues in which men have that will cause infertility, and that's 50% of the time. So before you start freaking out, before you start paying a bunch of money for freezing eggs or in vitro, there are simple labs that can be performed to find out egg quality, to find out semen quality and quality, and those things need to be done first. But don't start freaking out because you're 35 years old and you want to get pregnant and you don't have a partner. Go to your doctor, have a conversation about some of the labs to look at your egg quality, and then also look at, when you do find a partner, look at your partner and make sure that that there's an adequate sperm count and that the quality of the sperm is good. and then, start talking about family planning. But freaking out about, about advanced maternal age, again, don't freak out because you're 35 and you're not pregnant. Or don't freak out even if you're 39, 40 and you don't. There are women out here that do have issues, that have egg quality issues that in which they can't get pregnant, or that they have difficulty get pregnant because of egg quality. But that's not everybody. Everybody's body is different. So I am not against, by any means, against freezing eggs. I am not, because I definitely think all women have the right to fertility and to get pregnant when they want to. And if they don't have a partner, that it is in their best interest to freeze eggs, if they do have a declining egg quality. But that is a conversation that you need to have with your doctor. That is some testing that needs to be done to figure that out. But don't start spazzing out and freaking out just because you are 35 and you don't have a child. Or you're 35 and you want to get pregnant, and you think that the term advanced maternal age means that either A, you can't get pregnant, or B, that you're going to have a pregnancy with a bunch of issues, right? It is true that the older you get, the quality of the eggs change. That's why you do have more incidences of fetal abnormalities or chromosomal abnormalities like Down syndrome and those things. That does decrease, but again, those are incremental increases. So don't think that, okay, because you get pregnant at 40 or pregnant at 41, that you're automatically going to have a baby with issues. It doesn't happen that way. I'm going to close this out by saying I deliver healthy babies for, with mothers that are 40, 41, 42, 43 years old all the time. It happens all the time. So I hope this is helpful. Drop comments. I'll try to answer. This is just some general information for you guys to not spaz out. Like I hear, people really freaking out about advanced maternal age and infertility and not being able to get pregnant. And again, there are people that have true issues, but, find these things out first. Like, talk to your doctor, run labs, see what options are available for you before you close the door on things. All right. It's Doc P, Vagina Monologues. Take it light.